Well, when you go to see a doctor for your annual physical or checkup, they get a list of your vitals, they take some blood, they tell you where you stand right now. That's just a snapshot. But imagine if your doctor could have much more information, not just in that immediate window, but perhaps in the weeks or maybe even month leading up to that visit.
Right, and you don't have to sit there and fill out paperwork for hours upon hours.
Exactly.
That is now possible. Senior health correspondent Monica Robbins is going to join us to tell us all about it.
Sue VanWassenhove received a smartwatch from her kids to help her get more active.
Just to foster positive health in terms of, tracking how often I was moving and how many steps and all of those things.
After being diagnosed with an arrhythmia, Sue began tracking her heart rate.
A pattern that was starting to develop.
She used that information to follow up with a cardiologist and now sends EKGs directly to her doctor through her electronic medical record.
Who knows how to read an EKG? I don't, and most people don't, but sending it to her office immediately lets them look and see, like, yeah, you need to be checked out, Sue, and that's invaluable.
Dr. Vikram Bisen encourages his patients to use wearable monitoring devices like smartwatches, too.
It's not 100% accurate, but it's certainly to the point where if your watch is suggesting something, you should seek medical attention. And it's nothing that's urgent or emergent that you need to right away, but, certainly contact your primary care provider at least and let them know what's going on.
As a marathon runner, he uses devices himself, an Aura ring to track sleep and a smartwatch to track steps and heart rate. He thinks the devices help challenge his patients as well.
You may think you're being active and working out or, getting enough steps in, but until you see the data, you just may not know.
A national survey by the Ohio State Wexner Medical Center found that nearly 2/3 of Americans use a device to monitor their heart health, but just 1 in 4 use that data to prompt a conversation with their doctor.
So I think it'd be very valuable if they did. I have a few patients who wear the devices and they'll actually bring printouts, of their heart rate average for the last 6 months. Their glucose for the last 6 months. And I think it's very accurate, very helpful for us to get objective data as to what's going on at home.
Now, I will freely admit, Jay was sitting here saying that that would be me. I am one of the 3 out of the 4 that do not use all my data. And I am one of those people, I'm a total tech nerd,
I know
that.
you are.
And I love analytics, I love data. I've had this thing since it hit the market, 12, 13 years ago.
But you're not using it.
No, I'm not using it to discuss things with my doctor. I just, use it to inspire me to, oh my gosh, I have to walk more steps around the dining room table.
Y'all, she has a treadmill at her desk.
Yes, she does.
She walks
True story.
and types. It's unbelievable.
And I put this thing around my ankle because as I'm typing, it's not counting my steps, so I have to.
It's a thing in the newsroom.
Yeah, I know I'm pathetic, but yes, this does EKG. This does all kinds of things, and
invaluable information for your doctor.
It really is, and I should be taking it to my doctor and talking to my doctor about it, especially about my stress levels.
I imagine they're rather high when you're here at work.
Yeah, exactly, and I haven't been doing that, but this was a wake-up call. So anybody who uses these things, if you're using it, there's a reason it gives you all this information, and especially, and we already know that the Apple Watch, doing the EKG, they had already been shown to be rather accurate in doing
predicting events.
Predicting events, yeah. So don't mess around.
He's gonna get your info and say, geez, every day, just before 4, 5, and 6 o'clock, your stress levels are spiking. What are you doing?
Happened at 2:37 p.m.?
Yeah, I'm running down the hall for a Snickers is what I'm doing.
I'll keep my own log file. That's what we'll do. All right, Monica. Well, thank you so much.
Great info.
Appreciate it.
Great
Great reminder for everybody. Yeah.